Point of view, you have postpartum constipation. So common, but there's some things that you can do. First, make sure you're getting your water in. It's the most basic thing that you can do. You want to try to get half of your body weight in ounces unless your medical provider tells you otherwise. And then depending on how many weeks postpartum you are, you want to make sure that you're getting in some good activity because the bowels move when you move. And that can be anything from gentle walks to weightlifting to running, but it's really important you get assessed before you do any sort of high intensity activity. Continue to take the stool softener for as long as you need to. Ideally, your stool is going to be smooth like a sausage or a snake without cracks on the surface. It should feel complete when you have your bowel movements, and it shouldn't be associated with any straining or pain. Use a squatty potty. Based off of our anatomy, we're going to get the stool out a lot easier if we're in a squat position. There's something called an anorectal angle, which is the angle between the rectum and the anus, and it's a lot straighter when we're in a squat position. When that angle is straighter, the stool just has a lot less resistance coming out. Make sure when you're pushing, you're just very gently bearing down while exhaling, and you should feel your pelvic floor drop and open a little bit. And if having bowel movements is painful or you feel like you're not getting it all out, you can always try something called splinting, which is just taking the pads of your fingers and finding the perineum, which is right between the vagina and anus, and pushing up towards your head and back a little bit. That'll help push the stool in the right position so that you can bear down and get it out. Let us know if you have any questions in the comments.